How many people did you go to high school with? Keep that number in your head. Now, calculate 1.3% of those individuals. I went to high school with 1,949 students. If I calculate 1.3%, I get 25 people. If at random I chose 25 people from my high school, I feel confident that I would know at least a few of them. 1.3% is an important percentage. It's the percentage of individuals in the United States who are struggling with schizophrenia. You stand a good chance of knowing someone throughout your life who is struggling with this disorder. By educating yourself and knowing how to take action, you'll be able to help this person in your life. I've created the Schizophrenia Guide to Help. By utilizing this tool as well as knowing how to take action, we'll be able to help thousands of people every year. There's three phases of schizophrenia. Before, being before that person is diagnosed but still showing active phase symptoms. During is after the diagnosis and also the heaviest phase of symptoms. This is when the individual needs the heaviest treatment as well. After that person has received the correct treatment and is back on the road to recovery to lead a healthy and productive life. There's also three important areas of treatment during these phases. Individual, being what that individual can do by themselves to help them get the correct treatment. Medically, such as medical or health professionals or the right prescription drugs. And group or family, which is family support or group therapy. In the before stage, it's very important that individually that person is keeping a journal. By recording the changes in their behavior, it would help the health professional evaluate the situation and get them a diagnosis. Medically, it's a great idea to talk to a health professional to try and get the right support and the right help. This will also help them get the correct diagnosis and get the correct treatment immediately. Within family and group in the before stage, it's important that the family knows the signs and symptoms of schizophrenia. This will help the family detect the early warning signs and encourage that person to get the correct help. After that person has been diagnosed, they are then in the before or the during stage of schizophrenia. Individually, it's still a great idea for that person to keep a journal. This will help motivate them to see the positive changes in their behavior and how they are reconnecting and getting control of their life again. Also, it's important for that person to accept the diagnosis and begin to set goals for them to get better. Within medical, it's still important for that person to have either in or outpatient treatment. Inpatient being that person is in a full-time treatment facility for at least a month. Outpatient being that person is seeing a medical health professional at least once a week. With medication, it's important that person is taking the correct dosage at the correct time. Oftentimes, if medication is not taken at the right time, it can cause someone to have a relapse. Family and group is important at this time as well. Having the correct family support will help that person start to trust people again. Also, by having group therapy, it will help rebuild relationships and start communicating with people and back with reality. After that person has received the correct treatment and has started to progress back to a good life, they're in the after stage of schizophrenia. Individually, it's still an awesome idea to have a journal and keep a log. This will help them detect any signs of having a relapse. Within medical, it's still very important that the person is taking their medication at the correct time. Again, we wouldn't want to stop taking the medication because it would lead to a relapse. And family and medical, it's still great to have that family support there to help them lead their productive lives. Is there any questions?
Who is most likely to get schizophrenia?
Schizophrenia is equally likely in males and females. The most common age of schizophrenia is between 16 to 30, and also people that have high stress jobs or that are homeless tend to have a higher percentage to develop schizophrenia.
How long does schizophrenia last?
Schizophrenia has to last and have an active phase symptom of at least 1 month. So it will last at least 1 month, but it can also last up to a lifetime.
What does it feel like to have schizophrenia?
It often feels like a dream. People are not in reality. They often feel like the television is talking to them, or they are hearing or seeing things that are not really there.
Okay, after diagnosed, how long should you stay in treatment?
People need to maintain a level of treatment for a long time after schizophrenia. The thing we want to prevent is having a relapse. By continuing that medication and having a health professional evaluate that person's behavior, it will lower the chances of them ever having a relapse. By utilizing the Schizophrenia Guide to Help and educating ourselves, we'll be able to take action and help thousands of people. We'll be able to change people's lives and help them get back on the road to recovery, as well as leading healthy and productive lives.